Hello, everyone. I'm Esme Fuller Thompson. I am the director of the Institute for Life Course and Aging at the University of Toronto. We are so delighted today to have Rabbi Dr. Rena Arshinoff, who is a chaplain at Baycrest. She's been a frontline nurse. She has many years of epidemiology research. She's been a rabbi for the last 12 years, and she also has her doctorate in palliative care. She's a certified spiritual care practitioner at Baycrest, a board-certified chaplain, and a registered psychotherapist. Thank you so much for joining us today.
Oh, my pleasure. Thank you.
As a spiritual care provider, what are some of the issues you help older adults with when they're in the hospital or in a long-term care facility?
People are in hospital, and we're talking about older adults. There's a lot of fear. What's happening to me? Where am I? If somebody has some dementia, there can be some disorientation. And for an older person who has probably gone through a number of changes in their lifetime, this is a frightening one, to find themselves in the hospital not knowing what's going to happen next, or maybe if they're there for an elective procedure, there's still a lot of fear. When we talk about people who are in long-term care, certainly when people first come to long-term care, there is an adjustment, and there has been a series of losses. Now coming to a place that they don't know. There's a lot of fear. At Baycrest, we have many Holocaust survivors. So having another change like that can be very frightening. What's going to happen to me now? And it can take some time to become accustomed to where they are. So I'm a member of the healthcare team on the palliative care unit at Baycrest. The entire team works very hard to get to know the person, and we do have our conversations. Many people want to talk about the illness that they have had to live with, how that illness has progressed, what it's been like for them, their concerns about their family, and then some life reflection. Questions like, how will my family manage after I die? Who will remember me? How will I be remembered? Some big existential questions, as well as helping some people who've had some regrets, have had some difficult relationships with family members, to, if they want to talk about how maybe they can help reconcile those before they die.
What does spiritual care look like for older adults with dementia?
It's challenging for sure, especially when some people with dementia may not recognize their family members or recognize the staff members. When we're not in a pandemic, on Friday afternoons we have a Shabbat program to prepare for the Sabbath, which begins Friday evening, and so we have people together in what every floor has a recreation room, and people have the blessings for over the candles, the wine, and the challah, the bread that everybody loves. And then one of the rabbis comes in, and we sing some of the songs that they're familiar with, some of the prayers. I always tell something about the weekly Torah portion or a story. And that is something that becomes familiar to them. If they hadn't already had that as part of their life, it becomes a part of their life at Baycrest when they come regularly. And so they hear the familiar songs and they hear the familiar prayers, and it brings smiles to their faces because it's familiar and it's joyous. The Sabbath is about joy. So it varies, as everybody is so different. But bearing in mind that we go in with a very human approach and a caring approach.
How has the pandemic impacted your practice with older adults?
It's very difficult because there's no point of reference. And they know when I come in, sometimes on Fridays, I'll wish them a good Sabbath, but without seeing me in the context of singing, or talking about, the blessings, they don't quite understand. Um, the other thing is that the pandemic has really restricted visitors. So they are not having the visitors they're accustomed to having.
Could you tell me a little bit about the pandemic's impact on staff and how your interactions with staff go?
Oh, I do regular staff support sessions every month, and and the nurses and whoever else is on the unit comes to join us. And so I bring a number of different topics, and everybody takes part in that. But certainly, the staff have been absolutely um, saddened by the restrictions on visitors, that often people are dying and they can't have their family with them until they're very close to death.
Could you talk a little bit about this spiritual care provider role with family members who are providing care and or who are grieving after their loved one has passed?
Yeah. So a big part of my role is working with family members. Family members have what we call anticipatory grief. They begin to grieve before the death actually happens. And then, of course, they grieve afterwards. And my role is to journey with them, to be with them, to listen to their fears, to let them cry and sit with them as they cry. And sometimes I just sit there in silence, just so they know that somebody is there with them.
Great. Well, thank you so much. Now, is there anything else you wanted to share about your role or insights you'd like to provide?
There was a very famous Jewish thinker in the 20th century, Martin Buber, who said that the divine is found in relationships. And that's what I truly believe. That informs the work that I do, that the divine is found in relationships, in that space where I sit with somebody who opens up and shares with me. And so many times I say, surely God was in this place and I did not know it. Until afterwards I say, wow, that was amazing. For people to share with me the way they do, what a privilege.
Well, I can't think of a better note to finish on than that. So thank you so much for sharing with us your profession, your passion for what you do, and just the opportunities that you have each day to make people's lives better. I appreciate it.
Thank you, Esme.
Thank you. Take care.
Bye-bye.
Bye.